Hello, and thank you once again for tuning into the channel where we provide you with tips and tools to help you move with purpose. In this video, we're going to be picking up where we left off from the last video, which we're looking at factors that could influence a tibial rotation. In the last video, we took a look at how the hamstrings could influence this. In this video, we're going to take a look at the hip joint and how a malalignment or dysfunction could affect tibial rotation. In individuals that present with a tibial rotation, one of the things that I commonly notice in my practice is that the femur is internally rotated, or it's being held in an internally rotated position under loading, and that loading pattern can be something as basic as standing. This internally rotated position of that femur is a natural position to look for stability. This postural position is commonly seen in cases where a neural dysfunction or muscular activation is difficult for people to achieve, or they can't achieve it. So cases where individuals may have a cerebral palsy or some sort of a dystrophy happening, you'll notice that the body wants to fold in on itself with those affected areas. So you'll commonly see whether it's the shoulder or the arm starting to really want to hug in close to the body, or it could be that hip, and you'll see that femur rotate in and the knee rotating inward as well. So the body looks to get closer to its centerline position for stability and balance to make it easier. And it ends up hanging off of the joints and the ligaments instead of using its tension integrity to keep everything in an optimal position. While this compensation can help keep you in an upright or standing position, it's not an optimal position to be in. And you don't necessarily need to be suffering from any of these dispositions, as those are extreme cases, but you could have a simple weakness in the deep glute muscles that help externally rotate those hips and keep them stable under movement. The glute complex has 6 deep external rotators in it. Now, if you've ever been told that you've had weak glutes, these are probably the muscles that are actually weak. However, a lot of the exercises that are then prescribed target mostly your gluteus medius, minimus, and maximus muscles, which are more of the extensor muscles as well as lateral hip stabilizer muscles. Now, those are very important muscles as well. However, the 6 deep external rotator muscles, which consist of your piriformis, superior gemellus, obturator internus, inferior gemellus, obturator externus, and quadratus femoris muscles. These muscles connect directly to the head of the femur, and while their main purpose is stated as being external rotation, they actually play a much bigger role in dynamic stability. So as the femoral head is articulating in that hip socket, these muscles are playing a far bigger role with dynamic stability in terms of keeping the head of that femur centered so it can actually articulate properly with as little friction as possible. So if you're an individual that complains about having tight hips, these muscles are also muscles that are often tight. And they're often tight because they are weak. So they are hanging on for dear life to bring stability to that joint. And unfortunately, most of the exercises prescribed for these muscles specifically are stretches. And we don't necessarily need a lot of stretching with weaker muscles, but we do need some strength training. Not only are these deep external rotator muscles important for hip stability, but the sciatic nerve travels within close proximity to these muscles. In particular, the nerve travels by the piriformis and obturator internus. So any dysfunction with those muscles can cause a difference in tonality, which could end up pinching off that sciatic nerve and giving you sciatic symptoms. Those 2 muscles, in particular the piriformis and obturator internus, are extremely important because they also make up part of your pelvic floor, and having a good healthy pelvic floor is important for core stability, which helps your spine. So getting back to how An internal rotation at the hip could affect tibial rotation. If there is an internal rotation of that femur or thigh bone, it rests on top of your tibia and it is transferring load down into it. So if there is a malalignment with that bone, the tibia is then going to compensate depending on your particular disposition. Because of your tension integrity structures or tensegrity structures, there are a lot of factors involved in how that tibia may or may not rotate. So oftentimes with an internally rotated femur, I will see that tibia externally rotate as a compensatory pattern. So the individual is going to have a slightly knock-kneed appearance, and that tibia is going to want to externally rotate to compensate. However, there are many cases where the tibia also internally rotates to stay in continuity with that femur bone. There's also cases where it is the femur that's internally rotated, but the tibia stays in a neutral position, but it looks externally rotated due to that femoral internal rotation. So how can we strengthen these deep external rotators of the glutes? I previously posted exercise videos on movements that I like for this, but to generalize, my preferred movement is any single leg hip hinge position that involves an isometric hold, where your focus is keeping your hips and torso aligned and avoiding torsion. Once again, thank you so much for watching. I hope you found this information helpful. Please hit that like and subscribe button and share it with your friends if you did. Thank you once again.